So David here says, you know what helps chronic pain? Opioids, opioids, opioids. All right. You okay, David? Somebody should probably check on him. I'm sure he's okay. Robin says, I trust no one. Robin, I respect that. You can go ahead and keep doing that. That's great. Jennifer tagged Claudia. Hey, Claudia, I see you. How you doing? Welcome to the party. Chad Henning says, gotta love snake oil. Yeah, I don't really care much for snake oil, Chad, but I can tell you I do like avocado oil, olive oil, fish oil, and CBD oil. Yeah, that's actually a good one. What's up, guys? Dr. Leek here. And I just wanted to do this video as a follow-up to our initial launch of Eclipse Brand here just a couple weeks ago. And as many of you know, the reason why we started this project is because, well, there's a lot of people with chronic pain. Some suggest maybe 100 million in the United States alone. And actually, most will wait 5 to 7 years before seeing a pain doctor, which means most people actually try to treat their pain themselves using over-the-counter methods or what they can find on the internet in order to help them alleviate their symptoms. They don't want to go to a pain doctor, and honestly, who can blame them? So when I'm looking at this, I see a space where we can provide some value to patients that maybe aren't quite severe enough to actually see a pain doctor, to actually get on strong medications and maybe have more advanced procedures. These are people that are functional chronic pain people. They get around, they go to work, but every day their back hurts, their knee hurts, and they're looking for something that they can do themselves, purchase themselves, treat themselves with in order to make a recovery. That's the idea behind Eclipse Brand, is to target these kinds of people. And the launch was to basically say, hey, we have experience in this space. We treat chronic pain patients by the hundreds every month. And so we know what works and what doesn't, what medicines maybe are more helpful than others, or even what procedures are more helpful than others. And so I got into the comment section here, and I wanted to create this reaction video because it's interesting, the world of pain management, really how controversial it is or how divisive it is, and triggering, right? Obviously, pain is a very triggering and emotional thing to go through. And let's be honest, America has really not been really good about managing chronic pain in the long run. We went from a period where probably it was overlooked and dismissed to where pain became the fifth vital sign in the 90s. And then the opioid ramp came up through the 2000s, peaking in the early 2010s. And then the CDC and the government authorities got worried that maybe there was some overprescribing. And while they didn't immediately shut it down, the legislation was, let's just say, anxiety provoking for many of the providers. And so rather than taper a lot of these patients down or find alternative treatments, they were simply cut off. And I think that is what really led to the opioid crisis, or even the overdose crisis that we're seeing now. I'm hoping that pendulum swings back to some sort of middle ground, but even still, you can see how triggering talking about this in public forums can be for many people. If I were to make a video that's pro-opioids, let's say, I'm going to probably get a lot of hate from other people who have really suffered from taking opioid medications, who have overdosed or had family members who have overdosed or even died. And then conversely to that, if I were anti-opioid, right, we're going to see a lot of people that are pro-opioid come out and say that I'm not treating pain, or that I'm withholding some great treatment from them and causing their suffering. So, it's definitely a divisive topic, and I do believe that there is a happy middle ground. When you talk about individualized care, there's really not one size fit all, and that applies to pretty much every treatment, whether it's a spinal cord stimulator or if it's an opioid prescription, right? Like, not one treatment is going to be effective for every patient. And so I think that is the big reason why I'm coming online in this way, to sort of open up that discussion through our podcasts, provide a way where people can hear from someone who's actually practicing pain medicine, who practices individualized care. And that's what was a little interesting to me when I was reading these comments. It would seem like I would never write an opioid prescription. People were calling me out for not even writing any opioid prescriptions, but you don't really know what I do. And so I thought that was kind of interesting. So just to have some entertainment here, I'm going to go through some of these and we can read them together. So, you know, this video, if you haven't had a chance to watch it, it's introducing our brand. So the whole concept behind it is finding safe products that have been studied and backed by science that are good for pain management in many different ways, shapes, or forms. Now, just because one product is on there and you've tried that and doesn't work for you doesn't mean it won't work for somebody else. And so that's the whole point here. But, you know, I think some people get a little bit narrow focused. So the first question, do you even prescribe opioids? Well, that's a great question. Not sure how it's relevant in this particular case, but yes, Neil, I do prescribe opioids for the right patient. Absolutely, that's true. And then Chad, you know, I thought that was kind of funny. Chad responds, no, Neil, of course not. They like to jab to give CRPS, rather, complex regional pain syndrome. So no, I don't like to jab to give complex regional pain syndrome. In fact, I've probably seen it, let's say, out of 1,000 injections, maybe 0 times. Sorry, Chad, that's a myth. Let's continue on down here. There's a couple of things here. Oh, THC. So another reason why we're starting with CBD out of Eclipse Brand is because so many of our patients, Chris, are coming to the clinic already having tried or currently taking CBD or THC products. The problem is, like you're mentioning here, if you are on an opioid, right, a controlled substance, technically THC is illegal on a federal level. So in order for us as the pain physician to be compliant when we are audited and subjected to the law, we have to make sure that we're using this medication safely and not in conjunction with what the government considers to be illegal substances. And I know it gets sticky, and that's a whole like topic in and of itself, the federal government versus the states and individual rights and things of that nature. But as far as a pain doctor is concerned, we are regulated by the federal government as well, so we have to abide by those laws of the land. Now, kicked out of a pain management clinic, that's probably an over-exaggeration, although unless you're continued to show noncompliance with the plan, that may be a part of it. But the reason why we started with CBD is because a lot of our patients would go to head shops and other places where they would get products that say CBD on the label, and unfortunately there's also THC in there as well. And when they take this thinking that they are being compliant with the plan, their urine drug screen will come back positive. And of course that then will create some friction with regards to their compliance of care. So what we decided to do was put our label on this product, which we know is a pure product. Each bottle comes with a QR code you can scan. It's third-party tested, which confirms the exact amount of ingredients in each bottle. And when you get CBD-only products, that is THC-free, you can rest assured that you are not likely to test positive on our urine drug screen. So in that way, we are providing solutions and trying to make it more simple for folks. Let's see. Jamie says, you are not treating pain patients properly, and you know it. Shame on you. Oh, okay. Sorry, Jamie. I had no idea, but they seem to be doing pretty good. So I'm hoping you find someone that can treat you good too. John Ralph says, you are hurting people for no reason other than your profit and bank account. Trust me, John, there are way easier ways to make money than to operate a pain management clinic. I can tell you that. Robin says, I trust no one. Robin, I respect that. You can go ahead and keep doing that. That's great. Do your own research. Absolutely. Just as you would want your doctor to do his own or her own research, you should do your own research too as the patient. Robin says, I think you should go back to school and learn how to really treat pain. Wow, thank you, Robin. I will consider that. Perhaps you can tell me what school you went to, and I will consider possibly learning the ways of your experience. Jennifer tagged Claudia. Hey, Claudia, I see you. How you doing? Welcome to the party. Belinda says, your grifters rot in Hades. Wow, Belinda, who hurt you, my friend? I hope you find peace. Sharon says, you torture pain patients. I probably do, just because sometimes my waiting room is very full and, the chairs aren't very comfortable, certainly if you have back pain. And so if I do that, I can promise you it's unintentional, but as soon as I get to you, I will do my best to help you feel better. If you use CBD or marijuana, you ain't got a real pain condition. You know what this reminds me of? This reminds me of when Joe Biden said, if you ain't black, what did he say? Oh, you know what I'm saying. So I think, David, again, CBD is not going to work for everybody, but it will work for the right person. There are plenty of studies to support its use in the population, and it may not be for you. But like I said, Eclipse Brand is not really designed for someone in my clinic already. Although they may find something that still works, it's really designed for the people that are in a position to wait 5 years perhaps before they absolutely have to go see a pain doctor. Chad Henning says, gotta love snake oil. Yeah, I don't really care much for snake oil, Chad, but I can tell you I do like avocado oil, olive oil, fish oil, and CBD oil. Yeah, that's actually a good one. And of course, Julie says, you're kidding, right? No, Julie, I am not. So again, if you think that if you think CBD is really not for you, okay, that's great. That's part of the individualized approach to pain management. But I promise you, it does help someone. Oh, you know what? There's one more comment I wanted to read. Da, 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 da. Lisa Santos says, we have opioid receptors in our body for a reason, genius. Lisa, you are absolutely right. We do have opioid receptors, and thank goodness, because otherwise we would have a real hard time with pain. But we also have other receptors as well. We have norepinephrine receptors, serotonin receptors, dopamine receptors. Calcium channel blockers or calcium channel receptors. We have all kinds of receptors in our brain, spinal cord, and arms and legs that can and have been shown to reduce pain. And so just treating the opioid receptors, I think, misses out on maybe the bigger picture and also puts us at risk potentially for complications if we're really not the right patient for that medication. But again, there are right patients for opioids. And that's my point. Pain patients have really been, I don't want to say used and abused, but kind of used and abused. The challenge of pain management is real. It's really hard to treat pain. There are so many factors to consider when it comes to pain management. It's not as simple as take a pill. And that comes down to the type of person, their type of background, the type of injury, the type of medical diagnosis, and of course the different types of expectations and mindset also that the patient has with regards to appropriate treatment. But again, the reason why I'm on here and I've started Eclipse Brand and we have Eclipse Unscripted, which is our podcast, is to shed a light on the world of pain management and hearing it from someone who's practicing actively, seeing hundreds of patients a month, doing this now for over 5 years. And so I want to have that discussion. I want to hear your stories as a patient, the challenges that you're experiencing in the pain management world, the anxiety you might be feeling before your next pain appointment. Why are you feeling that? What experience have you had? What stories have you heard? Because I've also heard a lot of these. We get a lot of patients even from other clinics, and we're hearing, some pretty scary stories. So I definitely have a significant amount of empathy for what a pain patient has to go through. Like I've heard now they have this concept of a opioid-free ER. Okay, give me a break. As a pain doctor, I think that's outrageous. I can think of when I had a snake bite just a couple years ago, and worst pain I've ever felt in my life. And I'm not one to go to the hospital, but it was clear very quickly that I needed to get to the hospital. So, we finally get there. They slam an IV in, and they gave me some morphine. Well, morphine didn't work. And then they were able to give me what's that medicine called that starts with a D? Oh, Dilaudid. And it was fantastic. Took away that pain right away. And fortunately, after a few hours, it got better and I was able to go home. But if I were at an ER with no opioids and they're trying to give me some other medicine, which as a pain doctor I know is not going to be as effective in that acute setting, I'd be quite upset. There would be some letters written. So I definitely feel your anxiety in that way. And the challenge that is before us is how can we treat chronic pain in a way that's effective, that does not put more people at risk than helps, right? Because there's really no 100% safe way to do anything. There's no 100% way to treat a person with pain or a person with diabetes or a person with history of cancer. There's always what's the better way, right? And so I think that if we can have that conversation and learn from each other, learn how we can be good doctors and be good patients, then I think we will get a lot further than perhaps just attacking people online without really having any context as to what you're attacking. So that being said, I do want to invite you to a podcast. We actually did this a couple weeks ago. I was able to sit down with Keith Johnson, and Keith is the uh, uh, perhaps reluctant founding member of a group called Invisible No More. And they have a pretty significant following on social media, and they share stories as well, anxieties and challenges as it occurs living with chronic pain and being treated in the chronic pain space. So we got to sit down. Actually, it was one of our longest podcasts ever, nearly an hour and a half, where we open up some issues, talk about the challenges, and try to come up with solutions. So hopefully you can catch that, tune in, leave some comments, ask some questions. I want to keep this going because this is a huge need in our country. I don't see anybody, standing up, speaking out on perhaps on this side of the fence with regards to not only patient advocacy, but also education on behalf of what we have to do in order to follow the rules and make sure that we can continue to help you also in the long run. So let's keep that conversation going. Thank you for your time. We'll see you next time.